As with the 147 physicians who have exited this post before me, I come before you this evening with mixed emotions. I'm going to try not to pull a Speaker Boehner on you. I'm going to try to stay tear-free, but it's going to be difficult because I've had a wonderful year. 364 days ago, you gave me the honor and privilege to represent you, the physicians of Michigan, and this great society as your president. I cannot thank you enough, and I trust I've served you well. During my inaugural speech last year, I mentioned the importance of engagement, activism, being relevant, and promoting support for the medical community and organized medicine. If you remember EARS, I mentioned the importance of the public trust and the tremendous amount of credibility each of us carries with us in our designation as physicians, as healers. I spoke of the importance of developing leadership skills and learning to be better communicators with the public and policymakers and even your colleagues. For me, this past year has been about increasing our visibility, being good stewards of our profession, and protecting the public health. By your choice, you have been given an incredible, sacred responsibility to preserve and protect human life. The public expectations are high, and we must continue to fulfill those expectations by constantly remembering our priorities. First and foremost, it's about the patient. In spite of the challenges we face in the practice of medicine, this is our number one business, making people better. All else is peripheral noise. Making patients better is our flywheel. It's your momentum. It's what makes you and me answer that phone at 3 in the morning on those cold Michigan evenings, and we had a few of those during my tenure, and come in and give a life-saving anesthetic, or take the gunshot wound to surgery, or deliver a child into this world who would not have lived without that emergency cesarean section, or diagnose a disease with a cure you've prescribed. Whether you know it or not, and I think you do, it is actually what makes us, the physician, the happiest. That is, knowing as a physician we are able to provide high-quality care to our patients. You and I are healers. We don't just call ourselves doctors, we are doctors. Outside of my practice over the past year as a physician anesthesiologist, a special joy for me as president, MSMS president, has been the opportunity to travel around the state. On each of these visits, I met some remarkable people who not only were dedicated to their individual practices and communities, but also engaged in the health issues of the day and the support of their profession. My job was not only to represent you at those venues, but it was also to listen and learn from all that I was hearing and seeing. Whether it was a gathering in Delta County in the Upper Peninsula with Steve Menier, Dr. Steve Menier, Muskegon with Dr. Katrina Olson, Berrien County with Dr. David Puzicki, Alpena County with Dr. Robert Coombs, Genesee County with Shafi Ahmed, or Kalamazoo County with Jeanette Meyer. Just to name a few. I listened and I learned. I also heard from others outside of the county medical societies, including medical staff gatherings, such as Hurley Medical Center, and Chief of Staff Almadi Saeed, and from an expanding private physician group, the Northern Physicians Organization, headed by Peter Sneed from Traverse City. I listened to the challenges, I listened to the frustrations, and sometimes, sadly and understandably, I listened to the resignation. Some concerns had to do with their hospitals, some with the increasing burdens of private practice, the Michigan legislature, the federal regulations, the encroachment of physician wannabes, Some had to do with you and the medical society. And what are you doing all about this? It's good to look in the mirror. It's healthy to take inventory of who you are and what you stand for and where you are going. Many times I was asked for guidance. Although I assured all I did not have any silver bullet or magic wand, but time and time again I had the same message. Think of what's best for the patient. Everything else will fall in line. I also heard the good stories, the public health advocacy efforts of the MSMS Alliance, led by Cindy Ackerman, the Goodwill In Project for the homeless in Traverse City, the excitement of an accepted medical student in the match, or the partnering with Governor Snyder in Healthy Michigan. But you and I know I have taken each one of these opportunities to tell others the same thing. It does not stop there. Seeing and listening is only part of it. You have to be engaged. You have to be active. You have to act relevant to the situation at hand. I wasn't put here to watch puddles, and neither were you. Physicians are here to make things happen. You are here to make things happen. Together over the past year, we did so very effectively in a number of arenas, coalescing the deans of the medical schools to explore opportunities to revamp the medical school curriculum, restoring graduate medical education funding, and creating a collaborative effort between the Department of Community Health and the medical schools, working with the governor to expand coverage for the underinsured and uninsured, and partnering with DCH to advocate for the importance of timely vaccinations. In fact, on one occasion, I had the opportunity to fire Donald Trump in a press release for his misleading medical advice to avoid immunizations. Mr. Trump, stick to your entertainment. Let us worry about the practice of medicine. When I was given the privilege you bestowed upon me, do you know what my biggest fear was? I'm going to tell you this in a second. I was concerned about maintaining the image of this noble profession, an image which dates back centuries. I prayed not to embarrass this medical society by anything I said or did. I will let you be the judge, although I still have 24 hours left. I think I made it. I want to leave you and our incoming president, Dr. Grant, with this final thought, a quote which I find as applicable today to the profession of medicine as it was to the Irish Parliament in June 1963. The quote is from President John Kennedy, who would live only a few more months. He said, "It is that quality of the Irish, that remarkable combination of hope, confidence, and imagination that is needed more than ever today. The problems of the world cannot possibly be solved by skeptics or cynics whose horizons are limited by the obvious realities. We need men who can dream of things that never were and ask why not. It matters not how small a nation is that seeks world peace and freedom, for to paraphrase a citizen of my country, quote, the humblest nation of all the world, when clad in the armor of a righteous cause, is stronger than the host of error. You need to shed the bonds of your humility. You need to go forward and advocate for your profession and your patients. It's your expectation. It's part of your fabric. It's why you are here today. Again, thank you for the opportunity to serve you, and have a great House of Delegates.